Hello, Dr. Gross. My name is Matt Metzler, and this is my anatomy experience project. My goal for this is to teach the anatomy of the spine, as well as analyze some x-rays I have of my spine from when I injured myself. Enjoy. Good morning, class. My name is Matt Metzler, and I'm going to be your anatomy professor this morning. Today we're going to look at the spine, as well as look at some x-rays that I have of my own spine from when I injured myself when I was younger. To start, the spine consists of 4 segments. 1, the cervical section, 2, the thoracic, 3, the lumbar, and 4, the sacrococcygeal region. Now the cervical spine is the first 7 vertebrae that you have up in your neck. The thoracic is the next 12 down your mid-back, and the lumbar is the last 5 that you have. Now the sacrococcygeal region has vertebrae, but they're kind of different because they're actually fused together. The sacrum consists of 5 fused vertebrae, and the coccyx consists of 3 to 4 after that. That's what's commonly referred to as your tailbone. So, who out there can tell me what our very first vertebrae that we have articulates with? That would be the skull. Very good. The first vertebra that we have that articulates with the skull is C1, or atlas. Atlas allows us to nod our head up and down. The next vertebra down, C2, or axis, allows us to rotate our head side to side. These vertebrae are special because they allow us to do functions that we need to use on a daily basis. The basic landmarks of a typical vertebra are as follows. Starting anteriorly, we have the body. Moving a little more posterior, we have the pedicles that connect up to the transverse processes laterally. And then we have the lamina, a little more posterior, that goes up to the spinous process. Now the spinous process is what you feel when you rub your finger down the back of your spine. All those bumps are your spinous processes. Now we also have a vertebral foramen, or a hole right in the middle of all the vertebrae. So, who out there can tell me what we have that runs through the vertebral foramen? The brain! No, that would be the spinal cord. The spinal cord is protected by the vertebrae as it runs through the vertebral foramen all the way up to the brain. So, to review, who could tell me what the most posterior landmark on a typical vertebra is? How about you, Matt? Huh? I said, which landmark on a typical vertebra is the most posterior? Funny bone. No, it's the spinous process. And contrary to popular belief, the funny bone isn't a bone, actually, it's the ulnar nerve. Plus, that has nothing to do with the spine because it's in the arm, so please pay better attention next time. What? Moving on. So, who can tell me what part of the spine articulates with the ribs? The thoracic region, because the ribs protect the organs that dwell in the thorax. Correct. Thank you for paying attention, Matt. The thoracic region is the only region that has the costal facets on the transverse processes that articulate with the ribs. So, Matt, what is the name and function of the second vertebrae in our cervical spine? The funny bone! How do you even... It's called axis, and it does rotation. All right, let's take a break from lecture and talk about something a little more practical to everyday life. I have with me some x-rays of my spine from when I injured my back my sophomore year of high school. I was training for tennis over the winter, and as I came down from hitting the serve, I just felt something in my lower back go, and I just hit the ground. After I talked to my doctor, I was diagnosed with lumbar spondylosis. Lumbar spondylosis is normally when a vertebra slides or slips past one below it. And it's not to be confused with spondylolysis or spondylolisthesis. Those two both involve a fracture and a slip of the vertebrae. An article written by Carson Schneck, The Anatomy of Lumbar Spondylosis, states that the term spondylosis is normally applied non-specifically to any part of the spine that shows a degenerative nature. And so I was actually born with a congenital defect in my spine where I have degeneration, and that's why this was so easily injured when I was younger, because normally spondylosis only occurs in the elderly population, or in some cases like mine in young athletes. So spondylosis is more of the general term. It kind of covers a lot more of the possible degenerations of the spine, whereas spondylolysis and spondylolisthesis occur with actual fractures of the spine. So my spondylosis occurred between S1 and L5, which is the most common place for it to occur. And in the x-rays, you can clearly see this abnormality between the two. So, before we look, Who out there could tell me why a condition like mine could cause pain in the lower back? Because when it slips, it hurts itself. No, that is not the reason. Anyone else? Because when the vertebra slips past the other one, it could pinch one of the spinal nerves coming off, and that could cause pain in that area. Great job, Matt. That is correct. All right, let's take a look at my x-rays.
Here, as you can see in this first picture, is the lumbar section of my spine. You can see the body and spinous processes of the vertebrae labeled here. Since this is a lateral view, the lamina, pedicles, and vertebral foramen can't be seen. This next picture really shows where you can see the spondylosis. The sacrum is also easily visible with its 5 fused vertebrae. There is a visible slippage of the L5 vertebrae out of its normal place, and this is what causes the pain I feel. This last picture shows an anterior view of my spine, and here you can see that I also have some slight scoliosis in my spine. Scoliosis is a condition where there is lateral curvature in the frontal plane of the spine. It can be severe or more mild, like mine, which doesn't require any correction. By looking at the arrows drawn, you can see the slight curve that my vertebrae follow. Now, there are treatment options for spondylosis. Most common is just physical therapy and time. That is the route that I took. There is also corrective surgery that can be done. Alistair Gibson and Gordon Waddell talk about a treatment called lumbar fusion. This is where the 2 vertebrae that the spondylosis is affecting are fused together. This prohibits movement of that segment of the spine, which decreases the pain greatly. Alistair and Waddell found that 74% of patients who received the fusion surgery had positive outcomes.
So, to recap, who could tell me one of the differences between spondylosis and spondylolisthesis? Matt, how about you?
Spondylosis doesn't involve a fracture, whereas spondylolisthesis does.
Oh my god. Actually, yes, that is right. Thank you for paying attention, Matt. Well, class, that's all I have for you today. I hope that you enjoyed learning about the anatomy of the spine and taking a look at some real-world examples of how injuries to the spine can cause pain. So, good luck with your exams, and have a good weekend.
Got your spondylosis right there.